If you are looking for the best exercises to do if you have osteoporosis, you've come to the right place. Here, I'm going to show you the best at-home exercises. But before we get to the actual exercises, you need to know the background of how to do those exercises. And what I mean by that? Well, there are certain elements that you need to know, like the frequency, number of times per week, the intensity, how much resistance to use or how much weight to use, the number of sets and repetitions, as well as a special element important just for osteoporosis, and that is the tempo, how fast you should lift and lower the weight. So let's break it down. The frequency. You should be doing this about 3 times per week. 4 is pretty good, 2 is okay, 1 won't improve your bone strength. 1 will improve your muscle strength, but it won't improve your bone strength. So 3 is kind of the sweet spot. What about the number of sets and repetitions? If you have less than 6 months of strength training experience, that is within the last 6 months, not 20 years ago for 6 months, then you should be doing between 8 to 12 repetitions, 3 to 4 sets. If you have more than 6 months of consistent, proper, progressive, safe strength training experience, you should be doing about 4 to 5 sets of 5 to 8 repetitions. And of course, the lower the repetitions go, the higher the weight of the resistance goes. And so let's talk about the resistance. Resistance could be an actual weight, like a dumbbell, or it could be a resistance band. How tight is that? And so what kind of resistance should you use? The resistance should be sufficient that when you finish your set, whether that's 5 to 8 reps or 8 to 12 reps, you should ask yourself, how many more repetitions could I have done? And the answer should be, I could have only done about 1 or 2 more. If you think you could have done more than 2 more, then the weight is too light or the resistance is too low. So that's the frequency, the intensity, the number of sets and reps, and now the special element, the tempo, which is specific for osteoporosis. The tempo should be, you should be lifting the weight as fast as you can and lowering it under control. So if you're doing a curl, it will look like this, as fast as you can and under control. As fast as you can and under control. Studies show that for osteoporosis, tempo matters a lot. The difference between whether you're using a regular tempo and a fast tempo is about a 2% difference in bone density, or about a 16% difference in fracture risk. So now that we have those elements out of the way, let's talk about the actual exercises themselves. Next, let's talk about some exercises for the quads, hamstrings, glutes, and lower back. So if your osteoporosis is in the femoral neck, total pelvis, and lumbar spine or lower back, these are the exercises for you. I'm going to show you 5 exercises, but you just need to choose about 3 or 4 of these exercises. And here they are, in no particular order. First is something called reverse hyperextensions. So you lie down with your belly on something, whether that's a table, a couch, a chair, or anything else. And you raise your legs fast and you lower them slow, like so. Raise fast, control, fast, control. If this is too easy for you, you put a dumbbell between your ankles, like so, and the rest is the same. So lie down, raise fast, lower slow. Raise fast, lower slow. Next is deadlifts. Deadlifts can be done with dumbbells or resistance bands. Here's what they would look like with dumbbells. So you stand like this, feet about shoulder width apart, push your butt back, and then come up fast. Butt back, come up fast. Notice that my spine is straight. This is good, this is bad. So spine flat, and then up fast. Those are deadlifts with a dumbbell. Here are deadlifts with resistance bands. You stand in the middle of the resistance band, like so. Grab the bands fairly low, then come up fast. Down controlled, fast, controlled. Next is lateral squats. Lateral squats are very good if your osteoporosis is in the femoral neck especially. Here's what they look like. You hold on to something, person, door handle, couch, etc. And then you go down, controlled, up fast. Down, controlled, up fast. Those are lateral squats. And so you do all your repetitions on one side before switching sides. Next one is regular squats. So you're thinking butt to heels. You want to go all the way down, not halfway down. So this is good, this is not good. So go all the way down, fast up. All the way down, fast up. Now if you can't go all the way down, maybe you don't have the strength yet, hold on to something. Again, couch, door handle, person, etc. So down, fast up. Down, fast up. And the last exercise I'll show you is good mornings. With good mornings, you take your resistance band, step on the sides of the band, like so. 1 and 2. Okay, turn sideways to you. You put the band over top of your upper back, not on the neck, not here, but on your upper back. Okay, and then you come down, up fast. Control the way down, up fast. Okay, this one is particularly good if your osteoporosis is extra severe in the lumbar spine or the lower back. And these are the 5 exercises, 5 best exercises for osteoporosis of the femoral neck, total pelvis, lumbar spine. You don't need to do all 5, just select 3 to 4 of the 5. The next series of exercises is for the wrist. The wrist is one of the most common areas to get a fracture, because if you're falling down and you put your hand down and that's your first contact with the ground, that's the first to get fractured. And so if you have a low T-score in your wrist, these next 4 exercises are going to be particularly beneficial. Exercise number 1, you can do it with a dumbbell, you do it with a resistance band, and I'll show you both, is wrist curls. So you take an underhand grip, put the dumbbell in your hand, put your forearm on your thigh, and then go down, go up as fast as you can. Down, up as fast as you can. Down, fast as you can. With a resistance band, it would look like this. You would put the resistance band down on the floor, pin it down with your foot, and then stretch it out, give it a little bit of tension, and the rest is the same. Up as fast as you can, lower down. Up as fast as you can, lower down. Dumbbells are better, but if you don't have them, you can use a resistance band. The next one, so you have wrist curls, you have the opposite as well, wrist extensions from this way and up as fast as you can. From here, up as fast as you can. It's okay if the weight is not moving fast. The main issue is your intention. You have to want it to move fast, and then you're going to recruit more muscles and still going to pull the muscles harder. The next one is wrist abductions. Without a dumbbell, it looks like this. From here, it's just a very small motion towards the midline. Towards the midline. Okay. With the dumbbell, it looks like this. Fast, fast, fast. And lastly, the wrist adductions. So if this is abductions, this is adductions, this is abductions towards the pinky. As fast as you can. This is what it looks like without a dumbbell. With the dumbbell, it looks like this. As fast as you can. As fast as you can. With a resistance band, you hold it with one hand, and you put it in the other hand, and then you pull it out. Pull it out. Pull it out. Again, the tempo is important. You go out as fast as you can, you bring it in slowly. So these are the 4 most important exercises for the wrist, and follow the set and rep prescriptions from earlier. The next exercise is for the back, as well as for the biceps, and it's called one-arm bend over rows. So you grab the dumbbell, face this way, one knee here, or you can do it on the couch, on a bench, on chairs, bend forward, and then watch my spine. This is good. This is not good. So maintain a neutral spine and lift it towards the bottom of your ribs, like so. And down. Bottom of the ribs, and down. Fast, and down. The next exercise is push-ups, and that works the muscles of the chest, the front of the shoulder, and the back of the arm. Now, you can do it a number of different ways, and with a number of different difficulties. The easiest version is, of course, do it with your hands on the wall. A little bit harder is on a kitchen counter. A little bit harder is on a table. A little bit harder is on the couch or a chair, and then the hardest is on the floor. And so adjust it based on your own strength levels. I'll just show you how to do it on the couch. So you put your hands on the couch, or whatever surface you choose. Go down and then up fast. Down, up fast. Down, up fast. And that's push-ups. And the last exercise I'll show you is an overhead press. Overhead press works the muscles of the shoulders and the triceps. And there are a number of different ways to do it, and none of them are wrong. You can use any one of them, and it's actually pretty good to alternate. Here is one way to do it. You can do it one arm at a time by going up fast, down control. Up fast, down control. In this variation, my palm is facing this way. You can also do it with your palm facing this way, but same principles apply. Up fast, down control. Up fast, down control. You can also do this 2 hands at a time. Up fast, down controlled. Up fast, down controlled. Palms facing this way. And you can also do this with a resistance band. With a resistance band, you would just pin the band under your feet, and then the rest is the same. And that's overhead press.